So in this video, I'm going to share another trick with you where you will never ever forget about insulin. So during your Nclex exam or your nursing school exam, they will give you a lot of questions and they will ask you about onset, peak and duration. So after watching this video, I'm gonna show you 4 questions at this time. See on the screen. You may not be able to solve at this time, but for sure at the end of the video after this lecture knowledge I'm gonna share with you, it's going to be so simple for you that you will always get your answer right immediately, right? So let me show you this. So let's start now. Okay, so let's start. So I'm going to share a fiction story with you. So once you know this story, based on that you will be able to solve all your insulin question when they ask you, right? So let's start. So let's imagine that you are working in a healthcare or nursing home, any nursing home, right? Any nursing home facility, right? And you are working on a Monday. Let's say you are working on a Monday, right? You have a shift like 7 in the morning to 3 o'clock, let's say, right? Again, you are working in a nursing home which is 7 to 3 o'clock, 8-hour shift, right? First thing first, clear. Now you are working on a Monday, right? Correct? You are working on a Monday. So now you know Monday, when you are working on a Monday, it is so busy and difficult because everything pays up on Monday, right? First day of your work, Monday, and everything is like all the departments, they are open. So traffic busy here, there, correct? Now, so during your Nclex exam, they're going to ask you onset, peak and duration. 3 things you have to remember: onset, peak and duration. So now on Monday you start working, right? So just imagine you are having already so difficult day and one of your admission peoples come to you and tell you, hey, your admission is coming in 15 minutes. Hey, your admission is coming in 15 minutes, right? So we're gonna say the onset is 15 minutes. Your admission is coming in 15 minutes. That's the onset. Now you are already in panic. Oh my God, we are already having difficult day and an admission is coming up. So now you are already in stress, right? Now you are waiting for the ambulance. So you're looking on the door if the ambulance is already there. Now you are waiting almost 1 hour and there is no admission yet. Got it? Onset is 15 minutes. You are waiting almost 1 hour, still no admission. So peak is 1 hour. See, onset 30 minutes. Onset is 15 minutes. You are waiting for 1 hour, still no admission. And now it's almost 3 o'clock. There is still no admission, right? And you are giving to incoming nurse report, right? But what do you see? The ambulance is there. They just park it and they are bringing the patient in, right? So now you are giving report to your incoming nurse. They told me the admission is coming in 15 minutes. I was waiting almost 1 hour. And finally after 3 hours, the admission is here. So that is your onset, 15 minutes. Peak is 1 hour and duration is 3 hours. Got it? 3 points: onset, peak and duration, right? You got the point? Hey, your admission is coming in 15 minutes. It's been almost 1 hour, there is no admission. And now you're happy, you're ready to go and you're giving report to your incoming nurse. Hey, finally after 3 hours, the patient showed up. So now you know your points, right? 15 minutes, 1 hour and 3 hours. That's for fast acting insulin. The fast acting insulin are Novolog. The names end with log, LOG. Novolog, Homolog, and some of them called Aspart. So those are your fast acting. Homolog, Novolog, Aspart. Those are your fast acting. So that's the first thing for you to know, right? So now we are moving to Tuesday, right? We are going to next day, right? So today we're gonna discuss on Tuesday. We're gonna discuss about short acting. Short acting means Humulin R. That is your regular short acting medication, right? So again we're gonna discuss onset, peak and duration. So now imagine today is second day of your work and you have a one new orientee with you that is going to follow you, right? He or he is going to follow you. So the orientee is going to ask you, right? They're gonna ask you, how many patients do you have? So now what are you gonna say? You're gonna say, we have 30 patient with 2 nurses during your 8-hour shift. We have 30 patient onset. We have 2 nurses peak, and duration during your 8-hour of shift. See how simple it is now. So the orientee asks you, how many patients do you have? You have 30 patients, means 30-minute peak time, right? We have 2 nurses, so peak time is 2 hours. That is onset, that is peak time, and duration is during your 8-hour shift. So that's a short-acting regular insulin, right? Now you are working on Wednesday, right? That insulin called intermediate NPH. So humulin N or novolin N. That this insulin is cloudy. The previous one with that short acting was clear medication, clear, but the NPH is cloudy. You will see like cloudy. The solution is not clear. It's like a salt water kind of that cloudy thing, right? So now just imagine today is Wednesday and you're working again, right? So again, yesterday you were working with 2 nurses, right? With 30 patient and 8 hour of shift. Again today you are working with 2 nurses, right? During your 8 hour of shift. So 2 nurses means the onset is 2 hour during your 8 hour of shift. On peak time is 8 hour, and now your manager come to you and gonna ask you, one of the nurse called off for this evening, so do you wanna stay double? So now you gonna say, yes, I wanna stay double. You agree to stay double. So now instead of 8 hour of shift, today you gonna work 16 hours, right? Now you got it. So again you have 2 nurses. Onset is 2 hours during your 8 hour of shift. So peak is 8 hour, and because you agree to work double shift today, so duration is gonna be 16 hour today. Onset, peak, and duration. So that is NPH, right? Now you work Monday, Tuesday, Wednesday, right? Now you are off on Thursday and Friday, and you are coming back on Saturday. So Saturday is very chill day because most of the department people, they are like PT people, they are closed. The managers, they are off. So it's a chilling day. But now the problem is, so today, because of the short staff, today again you are working as a two nurses. So on set is two hours. So on Saturday, let me tell you one more time. So today is Saturday, and you have long acting Lantus, Lavimir, Determine. Those are the long acting medication. So Saturday is a chilling day, it's a long day, right, for you. Now again, onset today you have 2 nurses. Onset is 2 hour. Today you have no CNA. So peak is 0 or no CNA. You have no CNA. So you are working 2 nurses, but no CNA. Why there are no CNA today? Because from last 24 hours, because of shortage of staff, they are on strike. So from last 24 hours, they are on strike. Got it? So onset 2 hours, peak no CNA, 0 peak, no peak time, 0, and duration is 24 hours. 1, 2, 3, right? 2 nurses, 2 hour, peak no 0, and duration from last 24 hours. The CNAs, they are on strike. So there is no CNA. So you got it, all 3 points. So that is your long acting. So I hope review this video one more time to understand clearly, right? This is just an imaginary story, right? So once review one more time and you will see how easy it is for you to crack all the answer. So let's practice 4 questions and you will see, you will be able to crack it immediately. Let's see. Let me open the question. So let's practice first question and you will see how easy it is for you now. So the nurse is administering Lispro insulin and should keep in mind that this insulin will have an effect within which time frame. So effect means the onset, how quickly this medication start working. So as you know, all the homolog, novolog, Lispro, aspart, they are fast acting. So this medication is gonna start working. The onset, what is the onset? Hey, your admission is coming in 15 minutes. So the onset is, so this medication start gonna work. Answer A. See, simple for you at this time, right? And just to let you know, when you are giving Lispro, the fast-acting insulin, the food tray should be present in front of you, or you have to give this within 15 minutes before meal. Or the Nclex give you this question: you have to give Lispro. When is the best time to give? So you have to select when the meal is present in front of you, or just prior the meal, or they just deliver the meal. So that's when you're gonna give Lispro, right? Next question: a client diagnosed with diabetic mellitus receive 8 units of regular insulin, right? Subcutaneously 7:30 in the morning. The nurse should be most alert to sign the hypoglycemia at what time during the day? So when they are telling you, in this question they are asking you the peak time. When is this medication is on the peak? When the patient is gonna feel drop in sugar. So again, this is regular, which we are working on Tuesday, right? So they are asking for not the onset, but they are asking for peak. So on Tuesday, what we discuss, the orientee asks you how many patients do you have. So we have 30 patients with 2 nurses. So onset is 30 minutes, peak is 2 hours, right? So if they give 7:30 in the morning, the peak should be when? It should be 9:30. That is your answer. 2 to 4 hours. So Nclex, they're gonna give you like this kind of 9:30 to 11:30. So that's what you have to choose. 9:30. 2 to 4 hours, but that is acceptable. 9:30, right? So that is your next answer. They are not asking you onset in this one. They are asking you the peak. Onset, peak. Peak means when the patient blood pressure is gonna drop, and this medication is most on the top level, right? Next question: the nurse monitor for client for a hypoglycemic reaction, knowing that NPH insulin peak in approximately how many hours following administration. So NPH means that you are working on a Wednesday, right? So what was the Wednesday? So let me open. What was the Wednesday? So on Wednesday you are working again 2 nurses during your 8-hour shift, and the manager asks you, can you stay double? So 16 hours. So 2 nurses with 2 8-hour of shift, right? So that's mean 2 nurses 8-hour of shift. So your peak time is answer C, 8 to 12 hours. That is the answer you are going to select, right? Next, a client receive a dose of regular insulin Humulin R this morning 7 o'clock. At what appropriate time would the nurse likely anticipate the potential for hypoglycemic reaction? So this is, you are working on a Tuesday, right? So 2 nurses, 30 patient, 2 nurses, 8 hour of shift, right? So what is the answer? What do you think? So they are asking you hypoglycemia. So 30 patient with 2 nurses. So what is the answer? Should be 9 a.m., right? But what is the closest answer? 10 o'clock, right? So you have to pick that one. You cannot pick 8 o'clock because 8 is after 1 hour. No. So you have to put 2 to 4 hours of hypoglycemic reaction, right? So either is gonna be 9 to 10, that's the best option. So 10 you can select. 9, right? You have to select before 11. So 2 to 4 hours is a acceptable range. So it should be 9 to 11, right? So but what is the close answer? We have 10 o'clock. So that's what you're gonna pick. So that's the wrap up of your imaginary story. For you might be confusing, but again, if you review one more time, it's gonna be easy for you to understand what we were talking about, right? So I hope review one more time, and when you see during your Nclex exam, you will crack it immediately, right?